Today we are here with a new topic from Bechman and Ling Gynecology. So today we will discuss about the membrane manipulations. So it is a stimulating method in order to induce the labor. So what they said, induction of the labor by stripping or sweeping the amniotic membrane has associated risk including infection, bleeding from an undiagnosed placenta previa or low-lying placenta or and accidental rupture of membrane. So what does the membrane manipulation mean? So it is a method in which we cause and we stimulate the cervical lining, or we sweep the amniotic membrane. So this causes the rapid or fast dilation of the cervix. So it facilitates the labor. So it causes the spontaneous delivery. So it is a method in which the doctor put his or her finger into the vagina till to the cervix and causes and start to stimulate the cervix and start to sweep the membrane. Okay, so there are risk factors of this method, and this method is not so beneficial and is not so performed very commonly. Okay, so what are the risk factors? The risk factors including the infection, because it is an external intervention, the bleeding from an undiagnosed placenta previa. So what does placenta previa mean? Placenta previa is a condition in which the placenta is just above the internal os or internal opening of the cervix. So if the doctor is not known that this patient has some sort of abnormality of placenta, that is called as placenta previa. Placenta is attached to the internal os of the cervix. So and he start to put his finger into the vagina and cervix, so it may cause the rupture of the placenta, and there then start a bleeding. And lower lying placenta is again the same, that if the placenta is partially covered or a little bit covered the internal os. And accidental rupture of membrane is mean that when the placenta, when the doctor put his or her finger inside, definitely it touches the membrane, and when he swept the membrane there is a chance of rupture for the membrane. And once the membrane rupture, the amniotic fluid start to ooze out and start to come out from the vagina, from the cervix. Okay, so this is what we call as the early water break. Artificial rupture of membrane is another method of labor induction that may be used, particularly when the cervix is unfavorable. So artificial rupture of membrane, there is putting something from the vagina through the cervix to the membrane and cause the rupture of the membrane. So once the membrane rupture, the fluid leak out, and the amniotic fluid when leak out, then maybe the size of the fetus reduce, and it causes some stimulation of the cervix, and cervix start to dilate. So routine early amniotomy results in a modest reduction in the length of the labor, but may result in increased rate of the intraamniotic infections, umbilical cord prolapse, rupture of vasa preva, vertical transmission of HIV in HIV positive women, and cesarean delivery for the fetal heart rate abnormalities. For these reasons, routine amniotomy is not universally recommended. So we say that if you perform the artificial rupture of membrane, that is called also called as the amniotomy, that we cause the rupturing of the amniotic fluid. So when we break the amniotic membrane, there is a chance of intra amniotic infections, because the protective cover come out, and the baby is now maybe is available for the infections. That also causes some condition that is called as the umbilical cord prolapse, and also causes the rupture of vasa preva. So vasa preva is a condition in which the umbilical cord, we can say, is present above the internal os, and it is between and the head, that is a presenting part, and the internal os. So it also causes some abnormalities into the fetal heart rate that cause the deceleration of the fetus. We will discuss in later. So this is about the membrane manipulation.